I'm Andy Phillips. I'm privileged to be the Regional Executive Officer for HSE Southwest, serving the communities of Cork and Kerry. And it's pretty much exactly a year since I started this job. What a year it's been. It's been so exciting to be here as we change the entire health system and we live the Sláinte Care principles. And just in the next week or so, we're going to start absolutely delivering on Sláinte Care with our new integrated healthcare areas. So when I started this job, I talked about the 6 things I wanted to concentrate on. And I think if we can together work on those 6 things, that this will be a health service that our community is proud of. So just to jog your memories, those 6 things were quality. And by quality, I mean safety, timeliness, effectiveness, person-centeredness and productivity. And despite all of the increased demands we've had on a health system, we've certainly increased access for our community, for our services. And, you know, everybody who accesses our care system with urgent and really critical needs gets a really great service. We have struggled a little over years to make sure that people with less urgent needs also get an excellent service, and that's the journey we're embarked on now. But over the last year, we've seen an increase of about 12% in the number of people accessing our emergency services, and about 20% increase in people accessing our outpatient services across community and hospital. So really big increases in demand, and despite that we've taken many tens of thousands of people off the waiting list, and we've reduced the waiting times quite significantly for many of the people of Cork and Kerry. So the access journey, we have some way to go to meet the Sláinte Care targets, but we're certainly on the way there. In terms of safety, well, it's of great regret to me every time that there is a harm incident in our health system, and we really need to learn from those harms and increasingly be a health system where those harms are very rare and are never repeated. Just in terms of effectiveness, we've introduced many of those modernised healthcare pathways, and these are really paying dividends for our community. Person-centeredness, we have a little way to go, and I'm very pleased that we'll be introducing our patient partners into all of our system. And then you know that there's been a really big focus on the productivity of the system, of which more later. So in terms of quality, we have a way to go, but we've done excellent work together over the past year. And then in terms of value for money, well, we overspent our budget by about 2% last year. And clearly we have a way to go in terms of using our resources most effectively. And I talk about using every euro to its maximum effect, and we'll be doing much more to cut out waste and harm and variation from the system to deliver that value for money. The third thing that we always talk about is population health, because in this region we don't just have a responsibility for delivering services, we have a responsibility for people's health and well-being. And that means the accommodation that people live in, and it means the employment that they have and the education that they have. And those make up most of people's health and well-being, and we need to contribute to those as well as the services that we provide. And again, most of people's well-being comes from community and primary care services, and we've got some way to go in improving those things for the people. And then in terms of staff experience, well, I'm sad that many of our valued staff are sick at any one time. About 1 person in 14 in our staff is sick at any one time. We would need to reduce that to about 1 person in 28. Just imagine with a staff of 20,000 what we could do by reducing the sickness absence rate from about 7% to about 3.5%. That would be another 1,400 people in the workforce, and wouldn't that be really valuable for us all? So we'll be holding some wellbeing at work seminars and really supporting managers and staff, hoping to bring in physiotherapy and counselling, really to keep people well at work. And then the 5th thing that I always talk about is equity. And I was really privileged to launch the Travellers Action Plan a year ago today with the Chief Executive, Bernard Gloucester. But we know that we still have a long way to go to improve the lifespan and the health and well-being of travellers. It's really quite a problem in our community where the travellers have 10 years less lifespan than people who are non-travellers. The last thing we've been working on is sustainability and making sure that our healthcare activities don't add to the carbon burden and result in climate change. Again, our colleagues in infrastructure and capital have been doing a lot of work there, and I just call on all of you to do everything you can to avoid climate change. So those are the things that we started out to do. Much done, much more to do. And then just in terms of building the organisation, so we started by bringing all of the leaders of the organisation together. We've crafted some commitments that we make to ourselves and our communities, and I'll just talk about those a little. So those commitments are towards building a health service that our community is proud of, and we've allocated them according to the 4 HSE core values of care, compassion, trust and learning. So the first value under care and our commitment to patients is we'll value the time of those we're privileged to serve. For colleagues, we live our values every day. Turning to compassion, our commitment to patients is that we'll put ourselves in the shoes of those we're privileged to serve. Then compassion for colleagues is we support each other to be the best that we can be. Turning to trust, and trust is so important to me. For patients, we involve those we are privileged to serve as equal partners, and trust in colleagues means that we're one system, one team and one budget. And then of course we are a learning health system, and we're on the journey towards being an academic health science network, and that commitment to learning for patients is we'll avoid harm to patients and staff, and we'll continually work hard to improve our service 7 days a week. And we're clearly going to be talking to everybody, every member of staff, about how we deliver on that 7 days a week promise. And that will mean changes to working patterns for everybody, and me certainly included. Then the last aspect of our commitments, learning for colleagues, is we'll govern our services with transparency, accountability, participation, integrity and capability. And you can expect that those commitments are going to be part of our culture, the way that we do things around here going forward. And those will be things I hold myself accountable for and my executive team accountable for, and they in turn will hold every member of our staff accountable for delivering those. And we're going to be inviting many of you to a workshop quite soon around those commitments. So just turning to the regional executive team, we have nearly everybody in place, and I'm sure that we'll provide the names and maybe photographs of those who've been appointed to the executive team as part of this video recording. We have a few colleagues to complete the recruitment with, but I'm really delighted with the quality and the values of the people that we've recruited to the team, and they will introduce themselves. Now, the 3rd of March, Monday the 3rd of March, is a really important day because on that day we say farewell to the Community Health Organisation and to the hospital group, and we thank all of those colleagues who have given so much over many years, and in particular Professor John Higgins, who's been the Chief Executive Officer of the hospital group, and to Tessa Donovan, who's been the Chief Officer of the CHO. So thank you so much to those colleagues and all of those who have worked with them. And then the colleagues who've been working in support services for those organisations will join some different colleagues, and we'll make sure that everybody understands where they're going to be working and who their line manager will be and what their job is, and we'll make sure that happens very shortly for you. But really this is about how we serve the people. It's about Slauncher Care. It's how we deliver and how we live Slauncher Care. And that'll be in the very capable hands of our 3 integrated healthcare area managers. I'm delighted that we have 3 excellent colleagues who are our 3 integrated healthcare area managers. And we have Sonia Cotter, who's the IHA manager for Cork North and East. We have Priscilla Lynch, who's the IHA manager for Cork South and West. And we have Julie O'Neill, who's the IHA manager for Kerry. 3 excellent colleagues who, between them, will have responsibility for nearly 20,000 staff. So a huge responsibility, and they're accountable to me for delivering the services of the organisation. So those services are going to be integrated, and what that means is not just integrated between primary and secondary care, but it means integrated across the region. The concept is that we'll have a single regional team working with population accountability, but everybody will also have accountabilities across the region. So a tremendously exciting time, lots to do, a very busy health system that we're trying to change as we're running it, but just great opportunities. And I think everybody in the regional EMT is so excited to be part of this really excellent team and part of a really important culture. So once again, thank you for everything that you do on a daily basis. The commitment from everybody who works in the health system is really humbling, and I'm just delighted to have this job and to be working with you on delivering Slauncher Care, and I very much look forward to seeing you in your places of work soon.